Welcome to Offscript. Tune in every week to hear the stories of and insights from NPs. We're your hosts, Maxine and Danielle, two technologists who are passionate about the future of patient care.
Our guest today is Karen Yeboah-Norment, a dual board-certified family and psychiatric nurse practitioner and the founder of Pearls for NPs, an educational platform that allows clinicians to increase their confidence and succeed in practice. In today's conversation, we discuss Karen's experience as a psychiatric and family NP, her entrepreneurial path, and much more. Karen, thank you so much for joining us. Could you please give us your own brief intro?
Hi, guys. Thank you, Otto Health, for allowing me to join this platform today. So, I am Karen Yeboah-Norment. I am a family and psychiatric nurse practitioner. I've been a nurse practitioner for over 7 years. So, I've worked in a variety of different clinics. I've done home care, I've done primary care, I've done retail clinic. Currently, I'm doing telepsychiatry, seeing patients for mental health conditions, and I'm just glad to share my experience today. Thank you guys for having me.
Well, thank you so much for being on, and we're really excited to get into your breadth and depth of experience today. So let's start by talking about your career path and also your entrepreneurial path. We're wondering what motivated you to advance your career and become a nurse practitioner.
Yeah, so when I was in high school, I was thinking I wanted to do something in healthcare because I really liked science and I really liked helping people. So I was in between nursing and pharmacy, and then I decided to go with the nursing route. So one day in high school, I went to the library because I knew I didn't want to be a bedside nurse forever. So I went to the library, I researched advanced nursing careers. So I learned about what a nurse educator does, what a nurse practitioner does, what a nurse anesthetist does, what a clinical nurse specialist does. So then when I read about nurse practitioner, I was, oh, nurse practitioners are pretty much like doctors. You can assess a patient for a chief complaint, you can order, you could prescribe, you can come up with a treatment plan. So this is more what I want to do for the rest of my life. So that's why I decided to become a nurse practitioner.
That's an amazing kind of experience of knowing you want to do something more and not quite being sure and just being really open to the possibilities of what those different paths could have contained for you. And it's clear you found the right path for you, which is so great. So then you got your MSN as a family NP in 2016, and then you chose to go back and get your psychiatric NP certification in 2021. Can you share a little bit more about how you chose to become an FNP?
So I chose to become an FNP because I like kids. I like geriatrics. So with the FNP, you have the opportunity to treat the whole family. So you could treat from newborns to geriatrics. And then also with the FNP, you're very marketable when it comes to job selection. So you could work in college health, you could work in a pediatric office, you could work in a geriatric office. So that's why I decided, let me do the FNP route because I just want to be knowledgeable to treat the whole family.
Absolutely. And then how did you decide to add on the psych degree? And how has having both of those skill sets been helpful for you?
So when I became a nurse practitioner, I started at the retail clinic, which was called Ready Clinic. So I was there for 2.5 years, and then I transferred to primary care. When I was working in primary care, half the day was mental health. People were coming to me because they had complaints. I can't sleep, having panic attacks. I just went through a divorce. I'm nervous to go to college. So half the day was mental health. So then let me go back for the Psych MP certificate so that not only will I have the competence to treat patients physically, I would also have the knowledge to also treat patients mentally. So that motivated me to go for the Psych MP certificate. So then during COVID in 2020, I applied to Wilkes University. That's where I did my Psych MP certificate. So I went back for a year and then I got the Psych MP certificate in October of 2021. I'm really happy that I have both because honestly, sometimes when I worked in primary care, I would see a bipolar patient and they would be on these medications. I don't know what to do with these meds. You should go see your psychiatric provider in managing these meds because you don't learn much about antipsychotics and mood stabilizers in your FNP program. So now that I have both, it's just amazing that I could not only treat the patient physically, but mentally as well. Instead of referring them to psych, sometimes psych has a long wait time. So I could treat both.
Definitely. And it sounds like it was a very natural transition and a very natural evolution that kind of followed your interest and also what you saw in terms of patient need. And we've heard a lot about how core psychiatric care is to primary care. And even if you don't have an advanced certification, you often do end up doing a lot of psych related work in a primary care setting. So it's amazing that you really have both of those pieces and can provide such comprehensive care. As you think about the different roles that you've had, you mentioned at the beginning that you worked across a bunch of different settings. Can you tell us a bit more about those settings and how they compared, in particular, the Ready Clinic and some of the different primary care roles that you've had as well?
Oh, yeah, yeah. So I started my nurse practitioner career at the Ready Clinic. So I worked there for 2.5 years. It's very similar to Minute Clinic and CVS. The Ready Clinic was in Rite Aids. So at the Ready Clinic, I was the nurse practitioner, I was the nurse, I was the secretary. So basically, you work alone. As a secretary, I was like checking patients in, I was checking insurance eligibility. And then sometimes at the Ready Clinic, people just came for vaccines. So then I would like be the nurse. So I would like give patients the Tdap vaccine or the flu vaccine or the yellow fever vaccine, and then provide travel advice because some people needed that vaccine to go to certain countries. And then I'm also the nurse practitioner. So then I would see patients with acute conditions like a rash, a urinary tract infection, the flu, bronchitis, strep throat. So it was a lot of acute conditions. The Ready Clinic didn't have a very limited scope. So we didn't treat diabetes or hypertension. We didn't insert sutures. We had a very limited scope. Basically acute conditions, sports physicals, treated back pain, that type of thing. So that's what I did to start my nurse practitioner career. And then during that time, I was also per diem. I worked and did veteran disability exams, which I still do. So I see veterans who served in the Air Force, the Marines, the Navy. Basically, they put in like a service connected claim to try to get medical benefits from the VA and compensation. So like I'll see a chief complain, oh, I had a back injury in 1990 and I'm seeing them now. So I have to like look at their medical records to see if there's support that they were seen for back pain when they served and what's been going on with their back pain now. So that's pretty like, it's low stress. So that job is low stress. It's just a lot of kind of like digging in their file to see if they have proof and to see what's going on now. So then in 2019, I worked in primary care. So I treated acute conditions, I treated mental health, I treated chronic conditions like diabetes, hypertension. I also did home care. So when I worked in home care, I had to go visit 4 to 5 patients a day. And it was just, you basically would go to the patient's house, you would review their medications, go over any recent labs, do a depression screening, do a fall risk. That was a simple job. There's not like a lot of growth in it, or you're not challenged because it's just like a basic assessment. And then during COVID, I worked for 2 companies doing COVID testing and swabbing patients for COVID. And then one summer, I worked with the sports medicine doctor and I did sports physicals for middle school students and some college students. So that was fun. And then currently now I do telepsychiatry. So I've been doing telepsychiatry basically for over 2 years. So just like seeing patients for mental health conditions.
It's really so amazing to hear you share your career arc and just the versatility of your degree, and also just you as a person, clearly the ability to do all those different kinds of jobs and serve in all those different ways. We also know that now, along with the telepsychiatry work as an entrepreneur with Pearls for NPs, we'd love to hear a little bit more about why you created Pearls for NPs.
Oh, yeah. So I created Pearls for MPs in June of 2022. And I just created it because I saw how other nurse practitioners were using their gift to help nurse practitioners. So I was like, oh, I want to do that because I do like helping people. And I've been through a lot as a nurse practitioner. I've worked in a variety of settings. So I just wanted to pass that information of my experience to other nurse practitioners. So that's how Pros for MPs was created. So it offers 2 courses and mentorship. So currently I have 2 courses. I have a Pros for Primary Urgent Care course, which kind of goes over 20 common conditions that you've seen in primary care and urgent care, like what questions to ask when you're assessing a condition, what exam to do, and then it comes with like a sample treatment plan of what I did in the past when I was seeing those primary care conditions. So it goes over like sinusitis, obesity, diabetes, asthma. So it's like the 20 common conditions. And then I also came up with another course called Pros for Psych, which kind of goes over basically the most common conditions seen in psych. It's depression, anxiety, ADHD, bipolar disorder. So again, it just basically tells you what questions to ask the patient, what mental status exam to do, what medications to prescribe. So it has like all my pros and tips. With the psychiatry course, it goes over a case review. It has a sample bipolar disorder lab result on Depakote. It has an ADHD test because I go over ADHD because ADHD is very heavy now. Everyone thinks they have it or they want to be screened for it. And then it goes over what medications prescribe in pregnancy. And then with the courses comes like a meet and greet where after participants get my course, I meet with them. They could ask me any questions about the course and I could just go over like any nurse practitioner tips or advice that they have. I've had a lot of NPs reach out to me. Like I had a lot of friends. They're like, oh, I got this job offer. What do you think? So that's part of the mentorship thing, just going over tips on negotiation or jobs where you want to work, that type of thing. Also, the courses, they offer CEUs approved by the New Jersey State Nurses Association. I've also been interviewing other nurse practitioners because there's a variety of places you can work in. So if you check it out, I'm on Pearls for MPs on Instagram and then Pearls for Nurse Practitioners on Facebook. I interviewed my colleague who works in cardiology, a colleague who worked in anesthetics, a colleague who was doing veteran disability exam. So it's just a wide range of interviews as well.
That's awesome. It's such a beautiful genesis story in terms of you seeing other NPs helping other NPs and you kind of wanting to do the same and packaging all of your years of experience across different settings into these courses and this mentorship program and really giving back in a way that's very additive for you and also very additive for other NPs. As you think about the future, what is in store for Pearls for NPs and what's up next?
So what's up next is we're going to continue to interview other nurse practitioners on their specialties. We're going to also focus on nurse entrepreneurs. So I do have an interview coming up with one of the MPs I interviewed in 2021 about her starting her own private practice and her practice is going. So that interview is going to come up in May. So I'm actually going to go to her office, which is in Old Bridge, and she's just going to give a part 2 of what's been going on with her practice. And then hopefully early next year, I'll release like an entrepreneur book about being a nurse entrepreneur. So that's next. So still more tips, more MP specialties, and also focusing on nurse entrepreneurs.
That's amazing. A lot to look forward to and a lot of fun things in store for sure. We'd love to transition to learning a bit more about your day to day, given your unique setup. What are the typical hours that you work and how flexible is your schedule?
Okay, so currently I work Monday through Thursday from 9 p.m. to 7 p.m., but it's more like 9 to 9. So I do work remotely, but 5 days a month I have to go to the office in Cranford. So that's an hour from my house because I do have to be on site for patients who get TMS. TMS, it stands for transcranial magnetic stimulation. So it's just another successful treatment tool for depression, which doesn't involve medicine. So I have to be on site when patients get TMS mapping. So on a day-to-day, I typically do, psychiatric evaluations and medication management. So Mondays and Tuesdays are my heaviest days of the week. So this Monday, I saw like 20 patients. I did 3 psych evaluations, and then I saw 17 patients for medication management. So again, I'm just treating grief, insomnia, ADHD, anxiety, depression, social phobia, performance anxiety, PTSD, OCD. So it's just a wide range of mental health conditions. My schedule's not very flexible, unfortunately. So if I do need a day off, I have to use PTO.
It's clear that you're thinking through so many different cases in a single day of how are you customizing treatment for each individual and their situation. And I can imagine then, taking time off or being flexible when folks are relying on that is probably really challenging. So kudos to you for just being the steady Eddie in your patients' lives. I wonder what steps that you take as you're kind of working on all of these different things with each individual patient. What steps do you take to continue your professional development outside of treating patients?
I love to learn. I always challenge myself. So in my free time, I do a lot of courses. Like I've taken a lot of courses for professional development because you don't learn everything in MP school. So like recently I just went to Boston. I went to the Massachusetts General Hospital Child and Adolescent Psychiatry Conference, which was in March, which is amazing because we were taught by like doctors who worked at Harvard Medical School and professors that worked at Boston Medical. So it was really good. It was very helpful. It was a good refresher on like just common pediatric mental health conditions and what to prescribe. And it also a lot of cognitive behavior therapy and problem solving, which was like new because I see this with my patients. Like part of my treatment plan is not only discussing medications, but also helping patients problem solve what's going on in their life. So it was a good refresher of learning good tips on that. But I've taken a lot of courses. When I became a nurse practitioner, I like lived at Monmouth University. I took a lot of courses. I took an EKG course. I took a lab interpretation course. They offer nurse practitioner boot camp over the summer. So it just went over complex cases, casting and splinting, EKGs, lab, and suturing. So I did that. And then I also took like a pediatric course. I took a dermatology course because dermatology could be tricky with rashes. So I took a course on that. I also get like the MP journal, and I haven't done a lot of reading recently because I'm very busy, but the articles goes over like a variety of tips. So I like to just read on what's going on in healthcare legislation. So I read the MP journal when I get a chance. What else? I'm also in a lot of nurse practitioner Facebook groups, so it's nice to just log on Facebook, have someone talking about like a job offer or a patient case. So it's good to read other people's feedbacks on that. So that's how I just like stay up to date with healthcare and nurse practitioner stuff.
It's so clear that you love to learn. And I wonder how you prioritize your learning of when you're picking your courses. How do you think about this is the next most important thing for me to learn as a practitioner?
Yeah, I would just say when I started doing telepsychiatry, I had some patients come to me who were pregnant and they were like, "Oh, am I allowed to take this medication during pregnancy?" Because in MP school, when I did the psych MP course, they honestly didn't go over medications to take like if you're pregnant. So I had a lot of females come to me like, "Can I continue this in pregnancy?" Actually, I remember I saw a female recently, her psychiatrist like abandoned her. She was on a medication. I can't remember. I think she was like on Celexa or something. But basically, her psychiatrist abandoned her because she was pregnant. And so they abandoned her. She stopped taking medicine and her depression symptoms came back. So then she came to me. She was like, "I'm depressed. I can't function. I can't work. I need something, but I'm like 10 weeks pregnant." I put her on Zoloft because Zoloft has the most effective data in pregnancy. It's okay to take. I mean, no medication is 100% safe. So just even seeing females come to me for pregnancy, I was like, I need to know my stuff on this. So I decided to take like the postpartum Support International Perinatal Conference in November. So it was like a 3-day course. It went over conditions seen in females, depression, anxiety, PTSD, bipolar disorder. And then the third day just reviewed cases. If a female is pregnant, would you continue it? Would you change it? So that was very helpful. So now I'm even more confident when I see patients who are pregnant. And then also just learning with that conference, there is a free consulting line offered by Postpartum Support International where you could speak to a reproductive psychiatrist about a pregnancy case. And they could also give you feedback on that. So just like, yeah, I guess from seeing patients, I use Up to Date a lot. I like Up to Date. I use that pretty much daily. But when I'm seeing things and I'm not sure, then I'll be like, okay, I need to brush my skills on this. I'm going to take this course. And that's how I just start researching and planning ahead.
It's amazing how you really let your patient's needs guide what you prioritize from an education perspective. Like your patient asks you a question and you don't have a perfect answer. And so you go and do the learning to get the perfect answer, which is, again, just such a growth mindset and such a mindset of really caring about your patients. And it's really wonderful to see. Aside from Up to Date and the courses that you mentioned, are there other tools or technologies that you use regularly in your day to day work?
Yeah, so Up to Date is a biggie. I also use Epocrates. Epocrates is you could just type in a medication, you could read the side effects, the dosage. So I use Epocrates also. There's an app called the Wacko Guide. It gives like treatment guidance. So if you have a patient who is bipolar disorder and they've taken these certain meds, you could put in the meds that they've taken and you could put like what symptoms they're having. Are they manic? Are they depressed? And then I'll give you tips on what medication to try next. So I use that time to time. There's another app I use called Lally MD, which kind of is this colorful app that gives tips on medication side effects and dosages. Lately, I've been using the Infant Risk Center app, which is, again, It's a app which goes over medications, the safety of pregnancy. Is it okay for the mother to take during pregnancy? And also, is it safe for the mother to be on while breastfeeding? So I've been using that a lot. And then I use MD Calc as well, which is sometimes when patients have disease, if I need to calculate their creatinine clearance, I use that app to calculate that number. And then they also have screening tools like the PHQ9, which is the depression screening, the GAD7, which is the anxiety screening. So those are basically the bulk of tools I use.
Psychiatry, it seems like, is such an art and a science where there's all these science-based things. And then also sometimes you just have to figure out what the next best thing to try is. And some of that seems like provider intuition, but it's also really cool to know that there's tools to assist that in that intuition. We want to move into asking you for some advice for listeners. Based on your own experiences, what advice would you give to individuals who are aspiring to become nurse practitioners?
So the advice I would give is I would definitely learn the nurse practitioner role. So just do your research on it because there's so many different types of nurse practitioners. There's adult gero, there's pediatrics, there's family, there's mental health. So I would learn the role. Also talk to nurse practitioners, like learn what nurse practitioners are doing at their job. Do they have good work-life balance? Where they feel competent to start working? How's the salary? Get to know like the nurse practitioner field, like do your research. And then if you decide you want to become a nurse practitioner, I would recommend you just find a school that offers clinical placement, because I've been hearing a lot of schools, the student is responsible in finding clinical placement, which is you're already busy trying to study, get through the course load. Now you have to find your own preceptor. So I would recommend you find a school that provides clinical preceptorship. The school I went to, both schools I went to, they did, which was very beneficial. So that's what I would recommend to aspiring nurse practitioners.
That's excellent advice in terms of really understanding what are the options for specialties that are out there and being mindful of what those different paths entail, and then talking to other NPs to really learn about what their career paths look like. And then when you think about your education, prioritizing programs that help with the preceptor piece, which we've heard is quite a challenge, unfortunately. That's excellent advice for other students that are considering the NP path.
Do you have any advice that you would give to other nurse practitioners who are practicing today?
Yes, I would say be prepared to work and see patients, because most jobs, when you start, you'll have an EMR training, but they will expect you to start seeing patients. I've worked, like I said, I've had 10 different jobs as a nurse practitioner. I don't think I barely got any training, maybe 1 or 2 days of shadowing, but then you just have to start seeing patients and you have to like know your stuff. There are patients that are easy, but then there's a lot of patients that are complex. So you have to be prepared. So I would say get a mentor. Having a mentor will help you get through that MP transition from RN to MP. Also, make sure you have a good relationship with your collaborator. Get your resources ready if you have a question or if you have to look up something, but you got to know your stuff. And then I would also recommend, if you do have the opportunity, consider going to a community educational course a year. They teach you a lot. And like I said, you don't learn everything in MP school. Just giving that example about prescribing for pregnant women. So just going to an educational conference, if you allow it, would definitely help your confidence and it will prepare you to see a variety of different patients.
Such good tactical tips for how to know your stuff when there's so much information to know. Of have a mentor, find CEUs that speak to you and speak to the work that you're doing, and a bunch of other tips that I think are so helpful. Maybe our last question in the advice bucket is, do you have any tips or advice that you would give to NPs who are considering starting their own business?
I would say get 2 years, because you definitely want to be competent and prepared and see a variety of different cases if you want to become an entrepreneur. So I would say get 2 years if you want to start your own practice, and also speak to people who have started their own practice. Ask them, what were your wins? What were your losses? So you don't make the same mistakes, because becoming an entrepreneur is a lot of work. And to survive, you need to have patience to survive. So I would say definitely do that research. But it's very rewarding. I see a lot of MP entrepreneurs that are very successful, but being an entrepreneur is work. So do the research first and get at least 2 years of experience before you decide to become one. If you get the opportunity, I would also recommend you do an MP residency. When I graduated in 2016, I didn't have that opportunity, but since like 2018, a lot of healthcare systems are now offering it just because it does help with the RN to MP transition. It's like a 1 year program where you get to rotate family medicine, mental health, pediatrics, urgent care, and you get like weekly didactic lectures. So if you have the opportunity to do an MP residency, I would also recommend that as well.
That's great advice in terms of being prepared, being educated, making sure that you're fully ready for this next step, and doing the research to have confidence and competence in that decision. To close, we'll ask you the same two questions that we ask all guests. First, what changes would you like to see in the American healthcare system to truly improve patient care?
I would just say, like, I would recommend that they give patients more time. I guess, for example, like for medication management, it's only 20 minutes. So I would recommend the healthcare systems give patients more quality time because when you're seeing patients, you're like rushing and they have a lot of questions, or you gotta be like, I have to see you again because I can't finish what you came to me for today. So I would say the healthcare system needs to put less patients on the schedule and give more patients more time so that as clinicians we can address the problem or problems that they are seeking.
Absolutely. I think the time component is so meaningful. And when patients feel like they have the trust and also the time and space to really ask the questions that are coming up for them, then they're more informed walking away and can be better shepherds of their own health with the help of their providers. Our final question is, do you have any non clinical advice that you want everyone to hear or to walk away with?
I would say non-clinical advice would be always put yourself first, love yourself as a human being. Don't change who you are. When you're dating, when you're in professional life, just be you. Don't pretend to be someone you're not. And just be kind to people. You don't know what other people are going through. You just never know. Just be kind. That would make the world a better place. People just need to be more kind and patient.
It's very, very good advice. And thank you so much for being on. This was a joy.
Thank you. Thank you guys for having me.